Hi there, my name is Melissa and I'm a training specialist at Dermalogica South Africa. Today we're going to talk a little bit about hormonal challenges in the skin. Some of the times when we experience hormonal challenges is during our menstrual cycle, pregnancy and menopause. Some of the changes that we experience on our skin would be hormonal breakouts as well as hyperpigmentation. And we can see a combination of these two things at each of those different hormonal experiences that we experience on a daily, weekly, or monthly basis. So in today's session, we're going to talk a little bit about what does that mean individually, and then what would be the best solution for that client. Not only product, but lifestyle-based solutions as well. We know that if the cause and the trigger is still there, it makes treating that challenge very difficult. However, by having consistent skincare regimens that are used on a daily basis, and by trying to adjust and lead a healthier lifestyle, we will absolutely be able to influence your skin. So let's talk a little bit about hormonal breakouts. Now, these come and go on a monthly basis depending on what our hormone levels are currently at. It is very common to see an increase in sebum production, and if we're not exfoliating regularly, if you combine those two things, an increase in dead skin cells from a lack of exfoliation and an increase in sebum production, you have the perfect recipe for a breakout. Now, breakouts occur because the bad bacteria in our skin, what we know as P. acnes, these are munching away at the sebum and they're multiplying. So they're getting bigger and bigger and there's more and more of them, and we land up experiencing a breakout. Now, naturally, we want to go ahead and pick at the skin and squeeze the skin, but the challenge is that we often do it incorrectly and unhygienically. So it's important that we use targeted treatment products, we're exfoliating, and we're using cleansers and moisturizers that are going to maintain our skin health. The exfoliators that we use need to be exfoliators that are gentle but effective. Exfoliators that remove the surface dead skin to allow my follicle to become open, and targeted treatment products that are able to penetrate into the follicle. We want to remove any excess sebum, and most importantly, we want to kill off the bad bacteria. Once we have managed to successfully do that, we will have an influence on how the breakout develops on the skin. We know that having a hormonal breakout is inevitable, especially if we're prone to it. But how we treat that skin and how we look after the skin during that breakout is what is going to ensure a less pigmented skin afterwards. During pregnancy, we see a lot of hormonal fluctuations through the different trimesters of the pregnancy and even afterwards when we are breastfeeding our baby. These hormonal fluctuations can lead to an increase in hyperpigmentation. This hyperpigmentation is known as the mask of pregnancy or melasma, and it is seen in a butterfly effect on the skin coming from the center outwards. The key to treating a pregnant client is to keeping the routine basic but effective. So keeping in mind we do not want to use anything with salicylic acid. We can focus absolutely on using the Power Bright range to keep the skin bright and help to prevent that pigmentation from developing on the skin to ensure an even skin tone. Menopause is one of the last biggest changes that your skin goes through hormonally. What's really important here is that we continue to increase cell renewal, cell turnover, and keep the skin nourished and hydrated. During menopause, the hormones also fluctuate quite a lot here, and it's very common to then see an increase in hyperpigmentation as well. Even having thyroid and any other hormone-related diseases can also trigger hyperpigmentation. Lots of people that go on hormone replacement therapy also see a significant increase in hyperpigmentation in the same melasma effect. So the key here is to ensure that we stimulate cell renewal and cell turnover using advanced exfoliation, coming in for regular skin treatments, and using targeted treatment products that are going to continue to stimulate cell renewal as well as decrease the pigmentation that's busy being produced within the skin to help brighten and even the skin tone. Next up, we're going to do a skin bar session together. So I'm going to guide you through an incredible skincare regimen that you can do at home to really target your hormonal skin challenges. So you would have received the link that I sent you with the face mapping link on the www.dermalogica.co.za website. Once you have completed your skin analysis, don't forget that you need to email that through to me so I can also have a look at your findings on the skin. I know that you mentioned to me that some of your skin challenges were the breakouts as well as that hyperpigmentation. So I'm going to showcase specifically the targeted treatment products today that are going to give you the skin results that you are looking for. So what I would like us to start off with is by double cleansing your skin. So we're going to start by pre-cleansing, and we are then going to go into using our skin type specific cleanser. So while you're doing that, I'm going to do it at the same time, and I will guide you through what you need to use and how to use it. I have now completed my Dermalogica double cleanse, and I'm going to go ahead and use a targeted treatment product. I love using targeted treatment products because they really help focus treating my main concern on my skin quick and effectively. When it comes to hormonal skin, we know that we often see an increase in breakouts, we see an increase in hyperpigmentation on the skin. So choosing the correct targeted treatment for your main concern is what is extremely important. Someone like me that battles with hormonal breakouts, I love using the active clearing range, specifically the Age Bright Clearing Serum and the Age Bright Spot Fader, to really effectively, quickly treat my breakouts and reduce the risk of the post-inflammatory hyperpigmentation that gets left behind. What I also enjoy doing is to help focus on evening out my skin tone and targeting any pigmentation that I'm seeing from when I was pregnant. I enjoy using the C12 Pure Bright Serum. It's important that when you are layering serums or you're layering your Dermalogica products, it's important to remember that you always use the lighter consistency product first, and then you use the slightly heavier consistency on top. So layering is absolutely fine. Just make sure that you use the right consistency product first. So the lighter one first and the heavier one on top. When you're using a product like Age Bright Clearing Serum, when you open it up, it's important that you remember to only use about half of what's inside the glass pipette so that you're not overusing product. You can apply your Age Bright Clearing Serum everywhere to help even out skin tone, keep the skin hydrated, target the breakouts that you're currently experiencing, as well as preventing any future breakouts. So I'm going to go ahead and apply half of that, spread it in my hands and apply it everywhere. Be careful not to get too close to the eye area. It's important to stay around the bone because you don't want your product to go into the eye area. if you have a specific breakout that is particularly challenging to treat, it's really inflamed and it's taking quite a long time to heal, it is absolutely a great idea to layer up your Age Bright Spot Fader on top of your Age Bright Clearing Serum. So what you would go ahead and do is give it a squeeze and apply it to the tip of your finger. There it is. And you're going to apply it just to the areas of your breakouts. Give it a good spread, because not only are we going to target that specific breakout, we're also preventing future breakouts from developing on the skin as well. When I have done my double cleanse again, and I now want to perhaps focus on a little bit of that hyperpigmentation, the C12 Pure Bright Serum. This is also a fantastic serum to use for those that are pregnant or breastfeeding, because we know when we do have those types of hormonal shifts of the skin, we see what we call melasma developing on the skin, which is a butterfly effect of pigmentation coming from the center outwards. So what you would then be able to go and do is use 1 pump of your C12 Pure Bright Serum, spread it in your fingers, and you would be able to also apply this everywhere. Or you can specifically apply this to the areas where you're seeing that uneven skin tone and those darker patches of hyperpigmentation. When we go through menopause, it's still very common to experience the occasional breakout, as well as a decrease in luminosity and an unbelievable decline of collagen and elastin. My go-to product when I talk to consumers about the signs of aging, and that is our Phyto-Nature Firming Serum, a 2-in-1 serum that focuses on incredible hydration, incredible luminosity, and giving your skin back 5 years by reducing fine lines and wrinkles on the skin. What you're going to go ahead and do is you're going to place your finger in between the grooves, and you're going to apply 1 to 2 pumps of the Phyto-Nature Firming Serum into your fingertips. Then you're going to spread it and again apply this everywhere. By using your Phyto-Nature Firming Serum every single day, morning and night, consistency here again is key. With all of our targeted treatment products, consistency is key. We have double cleansed, we have exfoliated, we've used targeted treatment products, and the most important step every single day before you head outside is to apply an SPF. At Dermalogica, we have many different types of SPFs to target your skin needs. Those are some of my favorite targeted treatment products when it comes to treating hormonal skin challenges.